Hello, welcome to Dr. Hayatu Medical Sessions. Today, we'll discuss stroke, its causes, signs and symptoms, investigation and management. A stroke, also known as a cerebrovascular accident, is a medical emergency that occurs when blood flow to the brain is disrupted, leading to brain cell damage or death. This can result in various symptoms depending on the area of the brain affected. There are two main types of stroke, ischemic and hemorrhagic. Ischemic stroke. This type of stroke occurs when a blood clot or plaque blocks an artery, reducing or cutting off blood flow to the brain. The blockage can occur within the brain or travel from another part of the body to the brain. Hemorrhagic stroke. This type of stroke occurs when a weakened blood vessel ruptures, causing bleeding in or around the brain. This can be due to high blood pressure, aneurysms, or other vascular malformations. The symptoms of a stroke can vary depending on the area of the brain affected and the type of stroke. Common signs and symptoms include sudden weakness or numbness in the face, arm, or leg, especially on one side of the body, sudden confusion, trouble speaking or difficulty understanding speech, sudden trouble seeing in one or both eyes, sudden trouble walking, dizziness, loss of balance or lack of coordination, and sudden severe headache with no known cause. Physical examination. A healthcare professional will perform a physical examination to assess the patient's neurological function, including strength, sensation, coordination, and reflexes. Imaging tests. Imaging tests such as a CT scan or MRI can help identify the type of stroke and the location of the brain damage. These tests can also help rule out other conditions that may mimic stroke symptoms. Blood tests can help identify risk factors for stroke, such as high cholesterol, diabetes, or blood clotting disorders. Electroechocardiogram. These tests can help identify heart conditions that may increase the risk of stroke, such as atrial fibrillation or heart valve abnormalities. Carotid ultrasound. This test uses sound waves to create images of the carotid arteries in the neck, which can help identify blockages or narrowing that may increase the risk of stroke. Treatment for ischemic stroke focuses on restoring blood flow to the brain as quickly as possible. This may involve administering clot-busting medications such as tissue plasminogen activator or performing a mechanical thrombectomy to remove the clot. For hemorrhagic stroke, the treatment focuses on controlling the bleeding and reducing pressure on the brain. This may involve surgery to repair the ruptured blood vessel or remove a blood clot. Rehabilitation. After a stroke, rehabilitation is often necessary to help the patient regain lost function and improve their quality of life. This may involve physical therapy, occupational therapy, speech therapy, and other interventions. In addition to clot-busting medications, other medications may be prescribed to manage risk factors for stroke, such as high blood pressure, high cholesterol, or diabetes. Lifestyle changes such as quitting smoking, maintaining a healthy weight, exercising regularly, and eating a healthy diet can help reduce the risk of stroke. Taking steps to prevent stroke, such as managing underlying health conditions, controlling blood pressure, and avoiding excessive alcohol consumption, can also help reduce the risk of stroke. It's important to note that stroke is a medical emergency, and prompt treatment is essential to minimize brain damage and improve outcomes. If you or someone you know is experiencing symptoms of a stroke, it's important to seek medical attention immediately. If you found this information helpful, subscribe for more health-related content. Thanks for joining us.